And the Boxwood Alliance is a nonprofit organization who seeks to help seniors and their families and caregivers in accessing community resources available in the Mid-Hudson Valley. And we are doing these webinars so that we can bring information on different services available. So this week or month, our webinar is being presented by Johnathan Rivera and Laura Fallon of the Artis, am I pronouncing you correctly?
You got it. Artis Senior Living.
Artis facility. And we're very excited to have them. So I'm going to let you guys do your own intro because you'll probably do a better job than me. And then I think that you should be able to share your own, I think as co-host, you should be able to share a PowerPoint if you want to.
Okay, sounds good. Go ahead, Laura, you can start while I get the
Good afternoon, everybody. I'm Laura Fallon. I'm the Director of Community Relations for Artis Senior Living in Briarcliff. And we were supposed to open on April 1st of 2020, and the world fell apart 2 weeks before that. So we are waiting on the Department of Health, and they're just a little bit busy. So we're very hopeful. They've been here several times to be able to open, but when we do, we will be the very first standalone assisted living for memory impairment only. So the entire building, wayfinding, short hallways, very intimate dining areas. And the other thing that they've done is that they've gotten us an enhanced license. And what does that mean? Well, that means that we are able to do some medical care similar to what you can do in a skilled nursing environment, but we're not a nursing home. So we don't want to be a nursing home. We want to be an assisted living where people are engaged and actively enjoying their lives. But if and when that dementia takes hold of the brain in different parts and different types of dementia, sometimes people lose their ability to swallow. They lose their ability to take a step. They lose the ability to do certain things. And so Artis Senior Living has it so that we will be able to have people age in place and they won't necessarily need to go to a nursing home. We will be able to manage their diabetes or their oxygen levels if they have COPD. We'll be able to handle wound care. We'll be able to do modified diets and assistive too. So there's a lot of things that are really exciting about what we're doing, and we're also going to be expanding into Chestnut Ridge in Rockland County, Somers in Westchester. We're looking into, that's 2021. Then we're also looking into New Rochelle, New York City, Tappan, New York, and also possibly, first we need to open our flagship, and we're really excited about that. If anybody would like to come and take a tour, we can still give tours of the building in person, which you cannot do in any other community. But because we don't have residents, we'd be happy to receive you. Can give Johnathan or myself a call, and we'd be happy to take you out and give you an idea of what we're talking about. And when you see the building, understand that the entire building is open to those residents. They're not just in a corridor behind a door where they have to stay within a 50-foot confine. The entire building is designed for them, and it's open to them, and that's what we're about. So any questions or anything, please don't hesitate to let me know. And I will then turn you over to my partner, Johnathan, who's going to talk about the different types of assisted living in Westchester County or around the world or whatever.
Yes, around the world. I like that one, around the world, yes.
Johnathan, before you do anything, I'm just going to just remind everybody, if you need to get our attention, you can do one of three things. There's a little button to raise your hand. There is a Q&A box, which if you have questions and you want to ask them, we can answer them as we go. And the chat box is a super helpful thing, so that once we are talking, we don't have to interrupt Johnathan or Laura while they're talking, but we can get back to you.
All right, so I can start?
Yep.
Okay, great. All right, so thank you everyone for getting on this evening. My name's Johnathan Rivera. I'm the Director of Marketing of Artis Senior Living, the other half of Laura Fallon. So today we're going to be speaking about the different stages of senior living. So I like to go over this with families that sometimes tour initially, because if have a loved one that first gets a diagnosis of cognitive impairment, they kind of don't know the different levels that are out there. Most people know about home care, but they don't realize about assisted living, independent living, and memory care and what those differences are. So I like to normally give an overview of the different stages that there are available, so that way they just get a full picture of what they should be looking for. So I'm going to kind of go through that. I'm going to also have a little bit of information on what to look for when you are touring communities, different ways of how you can pay. And then if anyone has questions at the end, they can put them in the chat, or just, if Colin wants to unmute anyone and ask it live, they can also. Um, So there's pretty much four types of living arrangements that a family can look into if they realize that that person can't really live alone, can't live alone anymore. The most basic one is independent living. Assisted living is the second. Memory care, which is really more for people that have any type of cognitive impairment. And then where the care gets too much, there's a nursing home or the skilled nursing facility. So independent living is kind of the first step or first transition that someone can consider if their loved one, let's say, is still able to drive, is still somewhat independent, maybe is still able to cook, is able to somewhat manage their medications, but they want them in a type of environment where they kind of know down the line that they're going to need more assistance and possibly need to transition to an assisted living. Independent living would be a good option for them. This is normally people that are independent living normally are in their, sometimes I've seen late 50s to early 60s, sometimes late 60s to 70s, just depending on the situation and the type of independent living it is. Some are more extravagant than others, just like any place you go. But some of the pros with independent living is that they do have more freedom, meaning they can have their car there. It's pretty much as if living in an apartment. Most of them do have a full-size kitchen, so they are able to cook. It's also safer since they don't have an open gas type of stove. It's more of an electric stove, but you still have the amenities as if you were living at your home. You can park your car, you can come and go as you please, you can have visitors come over and stay over if you'd like. And also, the good thing with independent living, even with now in this world of COVID, is that normally they don't have many restrictions. Even if with COVID going on, if you're living in independent living, for most places, you're not getting a COVID test weekly or monthly if let's say there's an assisted living attached to where you live. And the reason being is because they really don't have any type of monitoring in terms of care staff if you're in independent living. It's pretty much, as it says, it's independent. The rooms are also normally larger than your typical assisted living apartments. I've seen some as large as like a 2 or 3 bedroom apartment for independent living. Some of them, some do, some don't. Some will have their own laundry rooms. They'll have walk-in closets. I've seen some that have 2 to 3 bathrooms as well, walk-in showers. So it's really more of a just like living at a home. It's just that you don't have to do the upkeep of living at a home. A lot of the independent livings will, provide usually at least 1 meal a day. If you want other meals, they usually will charge you for it. Most of them will provide housekeeping. Sometimes if you want it more than once a week, they'll charge you additional for it. Um, the other good advantage that some people like about it is that if the person that is moving out of their home into independent living down the line does need some assistance with ADLs, which is activities of daily living, whether it be some basic dressing, bathing, maybe needs to maybe can't drive anymore, needs to be taken to doctor's appointments. Home care is allowed to be brought in, and whether it's full-time or part-time is really up to the families. But that's also one good benefit where the person is pretty much alert, but they just need help with some ADLs. Independent living sometimes is a good option for them. Now, some of the cons with independent living is that with that freedom, there's also disadvantages. So with that freedom, there is no one there to really manage the medications. So let's say if your loved one is living in independent living and you're living in California, there's really not really a way for you to know if they're taking their meds properly, right? Unless you have someone that's a close relative or a friend that's able to check in on them. In independent living, they're pretty much on their own. There's no care staff that's there to to oversee them or to monitor them if there's an issue. Normally, there is 1 meal per day, every per day per week that's available. You can get more meals, but in some of these places, I've seen that they can get a meal plan as well. So it's really just up to the family and how much that person feels they're strong and still cooking on their own. Care staff is normally not there to monitor the residents. So if there is even an assisted living attached to that building, the home health aides, the med techs or the nurses are not really checking in on those residents, because that area is not really designed for monitoring. It's really for a person to be independent. Normally, when you're in independent living, from my experience, if home care is normally needed and home care is being relied on more and more, it's usually that's kind of the first sign where that person maybe needs to transition to assisted living. Independent living is good for a short time, but when it gets to the point where the person needs more assistance on a daily basis to get through the day, you normally are better off moving to an assisted living, because the cost of paying for independent living plus paying for home care can sometimes be more than having your loved one move to an assisted living or to the assisted living area, depending on what type of building it is. And then when it gets to that point where that person does need to move or transition to assisted living, it's a little bit more care provided. So this is what a typical kitchen would look like in assisted living. It's more of a kitchenette. So you lose that ability to be able to cook inside the home, or it's inside your apartment rather. You do have a microwave, you can have a fridge. Most places don't allow toaster ovens anymore. Years ago they used to, but now because of fire safety, they prefer the microwave. And even some places I've seen don't even allow the microwave, because depending on the resident moving in, they don't want to start a fire if they're, microwaving popcorn, for example. So with the assisted living, there are some good pros, is that the medication management is provided. They are able to give assistance with activities of daily living pretty much on any area needed. So anything from queuing, reminders, bathing, dressing, helping them to get to programs that can do all that. 3 meals are provided a day. There's snacks provided throughout the day as well. Housekeeping is provided. Normally it's done once a week where it's a thorough cleaning, so there's really no upkeep of the apartment, as opposed to where you're living in independent living, where that person still has to figure out how to do the laundry. That person has to take care of the dry cleaning if there is dry cleaning needed. So assisted living does give you that benefit where you do have care staff available 24/7 compared to your independent living. Social programs are all scheduled as well, so they can participate in whatever they'd like, or not participate in whatever programs that are available or not available. So it's kind of like, I like to describe it as kind of like living on a cruise ship. Everything's provided for you. You have all the meals, you have all the care, and you pick and choose what you want to do every day. So some of the cons with assisted living is, yes, you do have less independence. There is, staff, the care staff that's overseeing you pretty much 24/7. When you're sleeping, they might check in on you to make sure you're okay. You have a little bit less, you do have privacy in your apartment, but once you leave that apartment, you have a little bit less privacy. People are making sure you're okay. People are checking in on you, make sure you're eating properly, making sure you're properly dressed. Housekeeping, if they see something suspicious, whether you have, it depends. Every place is a little bit different, but let's say if they see you have, alcohol or liquor bottles and, it's kind of excessive, they might say something. And bring it up to people's attention. Just, it's a little bit more of a microscope on your life compared to independent living. That's the best way I like to describe it. But even with that less independence, sometimes that's better, especially if the person is someone that is starting to have beginning stages of Alzheimer's, dementia. Sometimes, but is not really needs to go to a full memory care at that point. It's still good to have that, even though they might object. It's still good to be able to have someone to be able to check in on your loved one, making sure that they're eating properly, taking their medications, and that that their apartment is kept on a cleanly basis. So the other thing with the condo is that it's not a skilled nursing facility. So if the care becomes too much for the staff, most of the times the nurse will ask you, or the executive director might ask you to provide a one-on-one aid. Now, with the one-on-one aid, it can get very pricey very quickly. If you're paying for an assisted living, even if it's a studio or a one-bedroom apartment, in Westchester County, for a studio or one bedroom, you're looking anywhere from, I've seen anywhere from $5,000 to $6,000 to $7,000 just for the apartment. Not to mention home care, which can add anywhere from $2,000 to $3,000 extra a month. It can get kind of expensive. So that's just something to, to keep in mind is obviously when a loved one's moving somewhere, you want to also look at the cost. Finances are always a factor in in any decision that you make. So sometimes the cost of an aid in paying for the apartment can be more than if you were to find an assisted living that can possibly provide more enhanced care. And I'm going to get into that in a second. Laura talked about it a little bit earlier, but I'll get a little bit more into details about that. So if it gets to the point where that loved one were to, has that beginning stages of dementia, Alzheimer's, maybe was diagnosed with Parkinson's, and the Parkinson's is starting to take effect more, starting to progress more tremors and need more assistance. Then the third option, which a lot of people don't know about, it's kind of something that's probably only been around for the last 20 years, I would say, that's starting to become more mainstream, is a memory care floor. A lot of companies now, a lot of the new buildings do have a memory care floor attached to their assisted living. And in some places, they do have all three: independent living, assisted living, and memory care. But the memory care is really truly designed for someone that really does have cognitive impairment, Alzheimer's, or dementia. So the programs, the meals, the layout is really designed for anyone that has cognitive impairment. It's really more for people that, and it's also great for people, let's say, that have cases of wandering, where sometimes they wander from the home. All of a sudden, they're going out driving, they don't know where they are. I've seen certain cases where people just went out for a walk and had no idea where they were, and all of a sudden they're a mile and a half away from their house and don't know who they are, don't know where they live. And that can be a scary situation for families. So a memory care community really is as safe as it gets for someone that has dementia or Alzheimer's, since it's a secure community. However, they still have the freedom to, to walk around the courtyard if there is a courtyard available. They're able to participate in programs. All the meals are provided, snacks are provided, medication management is provided, and all help with ADLs on a daily basis are provided as well. So those are some of the good benefits of memory care. And then some of the cons of memory care is obviously the resident is not able to leave the community. So depending on the person, you might have people that are in mid stages of dementia, Alzheimer's, that are still somewhat aware of their surroundings. And they, after a while, depending on the community and depending on the layout of that area of their memory care unit or floor, sometimes it's kind of, I've seen some that's kind of like a narrow hallway. It's kind of like a horseshoe around the courtyard. And in those instances, when people start to realize that there's one door to come in and out of that area, sometimes they will gather in that area knowing that that's kind of the way you can leave. And sometimes if they see the elevators or families are coming to visit and they go up, let's say, to the assisted living floor and they're having meals with their loved one, not now, obviously, because of COVID, but before COVID, if they were having meals with their loved one for breakfast, lunch, or dinner, they start to kind of put two and two together. They start to realize that that door, if they go through it, they can go upstairs. Not everyone does realize that, but that's also, residents that, have cases of wandering, they start to kind of get the routine down. And sometimes, in some cases, they can, if the staff is not careful enough, can memorize the code and are able to open that door once in a while, which I have seen in the past. So that's one of the downsides of being in a smaller type of memory care setting. And the other thing with memory care is that you really have no control over the acuity of the residents that live in that community. So you're going to have a mix of residents that have mild, mid to late stage dementia or Alzheimer's. And the cases vary depending on the person because everyone's at a different level with that disease. So depending on the community you're going to, if the residents have lived there for many years and there hasn't been a lot of turnover, the acuity can seem very high if it's a new person coming into tour. And also, there's some of the disadvantages of memory care is that the amount of residents that live there are somewhat small. The average memory care is usually I've seen anywhere from 15 to 20, 25, maybe 30 at most that you'll see on the memory care floor, compared to your, assisted living apartments, which can have anywhere from 80 to 110, 120, sometimes more apartments available. So the reason why that sometimes is a con is because when you have less residents that are able to live in that area, unfortunately with the industry, there is always turnover. So the chances of your loved one making new friends every few months is somewhat slim in a memory care community if it's a smaller type of environment. And sometimes that can be a disadvantage, especially if that person has early onset dementia. And most of the residents, let's say, have been living there for the last 5 years or 6 years. they might not be able to hold, be as social as that person that has, mild stage dementia is when they're moving into that community. So that's just something to consider. And it's also one of the questions I like to ask, or I like to tell families to ask sometimes when they're touring other places. So I know Laura talked about this a little bit earlier, but one of the advantages that some communities, whether it be assisted living or a memory care community, have is what's called enhanced care or a special needs license. The special needs license, I think, is very important because it really allows your loved one to be able to age in place as much as possible. Worst thing anyone wants to deal with is having to move their loved one to assisted living or a memory care community, and all of a sudden, a year and a half later, you get the phone call that we can't take care of mom or dad anymore because the care is getting too much. No one wants, the amount of time and effort it takes to move a loved one to a community is enough, but then to have to move them a year later or 2 years later is not necessary if you're able to do the research ahead of time and know what's out there and know what that community is able to do to the full extent that's possible with their license. So an enhanced license or a special needs license pretty much allows a community to provide more skilled nursing care compared to your typical assisted living. So some things that they're able, most of them are able to do is provide insulin injections, do a one-person transfer, a two-person transfer, provide wound care, can do a modified diet such as a liquid or pureed diet. Some of them can do, can push the residents in a wheelchair. Some can help and feed residents as well. So those are some things that you want to keep in mind. I've had a few instances of people that toured that where their loved one all of a sudden was a diabetic and all of a sudden needed insulin injections, and the community was not able to provide insulin injections. So now what they had to do is, and home care normally was not going to come in to do an insulin injection daily. So the family had to take turns of who was going to go in daily to give mom her insulin injections. Now, now it's fine, but it could become an inconvenience for some people, especially if they want to travel. You always have to, keep that in mind when you're moving a loved one in, is that, now it could be convenient, but it might not be convenient. Let's say if something happens or something changes in your life and all of a sudden, that responsibility still has to be done. So to kind of mitigate all of those concerns, I always tell families to make sure that that community has an enhanced license. It causes a lot less headaches, and also just really let your loved one be able to age in place as much as possible. And also a lot of these communities, whether they have the enhanced or not, most of them are able to even have your loved one age in place all the way to hospice if it gets to that point. So sometimes I get this question also is how is assisted living and memory care apartments funded? Most places is usually done privately through private funds. Some long-term care insurance most long-term care insurance policies will you'll be able to file a claim with them depending on your policy. And some companies also a little bit different. So some will actually give you more funds per day if it's in a nursing home compared to assisted living. So you just have to look out when when you're calling the companies and seeing what they're able to offer. Because sometimes it can be exorbitant. I've seen some where they're able to give $250 per day for assisted living, but $500 per day for a nursing home. And that's a big difference of finances. So sometimes, you have to look at the cost and you have to look at what makes more sense and where is mom or dad in terms of what she needs help with on a daily basis or he needs help with on a daily basis. VA benefits, if a person served in wartime in World War II, Korea, or I believe also Vietnam, VA is able to give a small stipend that can be used towards assisted living apartments, which is usually, I think anywhere from $1,000 to $1,200 or $1,300 a month extra. Now, in the rare chance, which in Westchester County, if you know, is rare, some will have Medicaid beds available. There's a handful that I know of that do provide Medicaid if it gets to that point, but it's far and in between. But those are usually the 4 different ways that you are able to fund an assisted living or memory care for a loved one. And okay, another magic question I always get is, why do communities charge a community fee? Why is there a community fee? Well, a community fee really is why communities charge it, or why companies charge it. It's really to incur the cost to get that apartment ready. There's a lot of labor details and work that gets in, to get an apartment ready, to get all the paperwork together, to do the assessment for that loved one, to make sure that they do qualify to live in that community. The labor involved, if let's say the apartment has to be revamped or renovated, the logistics in terms of getting the furniture together to get that loved one to move in, it takes a lot of work and man hours. The reason they charge it is that, let's say for whatever reason the apartment is left in disarray. You have a person, let's say in assisted living, that doesn't smoke, and all of a sudden they get caught 5 times, 6 times smoking in their room. That smoke, does leave a residue. Unfortunately, sometimes if there is incontinence and the person is, adamant on not using the pen, sometimes there can be soiling on the rug, which can, penetrate and absorb, and then all of a sudden, the room is not how it was before that person moved in. Can have an odor and things of that nature, or even as simply as, the person just wasn't a cleanly person, and there's stains all over the place, and they just can't be cleaned up with just normal use. Sometimes it has to be repainted, has to be the rugs have to be pulled up. So that community fee is pretty much to, absorbs the cost of having to renovate that apartment if necessary. So some things just to look for when you're touring. I know now with COVID, a lot of places aren't able to tour. We're actually one of the few places you can actually go into the building and tour, since we have no residents. But once COVID lifts and you are able to go in person to look at a community, one of the biggest things I always tell families to look at is you want to look at people's faces. Look at their facial expressions. Are people smiling more or have more sad faces? And that goes not just for the residents, but also for the staff. You could tell a lot by a person's appearance, and if people are smiling and laughing, or if people are just really quiet and kind of dreary and droopy, right? So that kind of tells you the environment of what you're walking into. If you're just really just looking at the facial expressions of the people that are in that community. If you ever get a chance to try the food, obviously now you can't with COVID, but if you ever get a chance to try the food, you want to see how how the food is, what's the menu look like, is there a variety, are there different options to choose from? Other thing you want to look at when you're looking at an apartment, how is the upkeep of the community? How's the building? How's the outside? Is it cleanly? Is the inside cleanly? If you go to the bathroom, was the bathroom clean? Does the community kind of need a new paint job? Does it seem pretty renovated? Is there any areas that might need updates? These are all good questions to ask. Even on a tour, you can ask them, when's the last time your building had a renovation? What's the last thing that was renovated? It's just good things to know, because you want to know if the company is willing to invest in the building to make sure that it's proper and that it's as nice as possible. Not every company is able to do that, but it's good to know, is the building being, maintained as best as possible. And then you also want to ask yourself, how is the actual tour? Was it a customized tour based on what you told the person over the phone in terms of what your needs were? Or was it more of a cookie cutter tour? They kind of just showed you everything and wasn't really customized based on what you're looking for. That's usually a big telltale sign of the type of customer service and the type of attention to detail that the staff give. Because if they can't even do a tour properly and hit on the needs that you're looking for, that's kind of a red flag in my eyes. That kind of tells me that if they're doing it with me, they're probably doing it with everyone else. And then that kind of makes you wonder about how's the care at the same time. If they're doing cookie cutter tour for me, are they doing a cookie cutter type of care for everyone that's there as well? So you just want to, be mindful of that and see, are they hitting on the questions or answering the questions that you're looking for when they're doing the actual tour? Another good thing with technology is you want to look at the reviews. Look at Google. You can look at Yelp. You can look on Facebook pages. There's a lot. I mean, now compared to 15 years ago, you go anywhere, people take more pictures of food that they're looking at when they're at the restaurant than the actual restaurant itself. Imagine. So, just like you can get a review of any restaurant you want to go to, you can get a review pretty much of any community that's been around for the last 5 years. You just got to do your research. Google reviews is very good. Other thing I like to do, I didn't put it on here, but if someone, if they're able to have you speak to someone that's been living there for a little bit, speak to one of those adult children and get their experience and see how it is, how their mom or dad has been living there. I also like that too, because most of the time they're going to be a little bit more honest to you than compared to the person that's giving you the tour. Obviously it's going to be someone that they know is going to say good things about the community, but they're going to be a little bit more honest than a person that's giving you the tour. Just because they can tell from their experience as an adult child compared to someone that's a staff member. Then the last one is a skilled nursing. So in certain cases, if the care gets too much for assisted living or someone that lives in memory care, even with the enhanced license, it will happen. If the person becomes bed bound, if the person all of a sudden needs breathing tubes, IVs, tracheotomies, is on life support, that's really where you kind of need, that person needs a nursing home, needs a skilled nursing setting. Assisted living memory care does the best we can, but at that point, a nursing home is the best fit. Because really it does provide the highest level of care possible aside from a hospital. Some facilities do offer Medicaid beds, and also some of them do offer long-term Medicaid beds as well, which you'll find that more available in a skilled nursing setting than assisted living. And some facilities actually do have a secure memory care floor as well. Now, mind you, the secure memory care floor is going to have all different types of people, just like a standard memory care does as well. But it's also secure if you're concerned if that person is still very agile, very ambulatory, and you're concerned about wandering. Secure memory care floor, it does have its advantages as well. Some of the cons, obviously it's more of a clinical setting. It's on a social model, so it's not really geared towards programs and activities. They do have programs and activities, but it's not, they're kind of cookie cutter programs and activities. It's not truly customized as if a person lives in assisted living or memory care, because it's based on clinical. It's not based on the social model. Mix of high acuity and low acuity patients, so you have no control over, if you're sharing a room, you have no control who that other patient is next door to you. You have no control, who's across the hall from you, who you're sitting with at, obviously if the person you're sitting with at lunch or dinner is not someone that you're getting along with, they can move you, but you really have no control of that environment. It's more of a skilled nursing, skilled nursing setting. I think that's my last slide. Yeah, it's my last slide. So yeah, I thought I had another slide there. Yeah, that's pretty much kind of the different stages that you have with senior living, different options. I don't know if anyone has any questions about anything or any concerns or ran into something and didn't know why, the community was doing what they were doing. You can let me know. I've pretty much seen every type of layout you can think of for assisted living, memory care, and independent living. So any questions you have, I can definitely answer for you.
Okay, so I'm going to ask if anybody has any questions to do one of the three things. Raise your hand and I will unmute you, or put them in the Q&A or put them in the chat, and we'll give you a minute or two to do that while you, think about what it is you might want to say or ask. And I'm happy to unmute you if you want to ask a question, but I don't want to leave it one person at a time, so we don't have too many people talking at the same time. So let me give everybody a minute. Thank you. That was very good. I like a lot of the suggestions. People don't really know often what to ask or what they're even looking for. You expect that people are coming in knowing what they're looking for, but they often don't have any idea.
Yeah, exactly. And knowing, really knowing the different stages really kind of eliminates a lot of the choices that aren't a good fit. And, right off the bat, you can look on the website and know automatically, okay, if this place is only independent living and my mom has dementia, that's not what I'm looking for. So it kind of also helps you filter out from doing tours that you really don't need to do if you already know off the bat it's not a good fit. So it saves time and energy. It's really what it does.
Okay, so one of the questions that was asked was, how long has Artis been around, and is it a national organization?
Yes, Artis Senior Living has been around since 2012. It is a national organization. We build, own, and manage all of the properties. Right now, we have about 20 communities throughout the whole country. It's mostly on the East Coast, but we have communities in Pennsylvania, New Jersey, Massachusetts, Connecticut, Florida, Illinois.
Minnesota.
We're pretty much a national. We're a national company, and we are expanding. We are hoping in the next 5 years to double the amount of communities we have from 20 to 40. So we're actually the first, as Laura was saying, we are the first flagship in New York State at the moment. So.
Also, I might mention that there's quite a difference in the cost, and each community that you're going to be touring, that you'll be able to decipher, how much money you have and how far it has to go. I can tell you that skilled nursing typically runs about $15,000 per month, unless you spend down and get onto your Medicaid, and then Medicaid covers for skilled nursing, but Medicaid typically, like John says, does not cover assisted living. There are just a few other states that is not the case. Other states do have more options for assisted living with Medicaid. But
Mhm.
assisted living can be anything from $4,000 up to, you know, $12,000 to $15,000, and independent living can be vary also in the communities that you're researching.
Yeah.
And they can start at $1,000 a month, very low end, up all the way up to $10,000 a month. It really depends on what you're looking for.
Yeah. And also location is a big factor too. If let's say you are closer to Connecticut, like the Valhalla, Rye area, sometimes you're better off looking at assisted livings in Connecticut because they can sometimes be anywhere from $2, $3 to $4,000 cheaper compared to, you know, a community in Westchester.
Really? That much difference?
Yeah, if you go up to, you know, depending on where you live, you know, if you're willing to hike a little bit, like Norwalk area, Darien, they're normally about $2,000 to $3,000 cheaper per month compared to any place you look at in Westchester County, and that's for AL and memory care.
Wow.
Reason why is just because it's a different demographic of people as well. So even with Rockland County, if you're willing to go across Tappan Zee Bridge, there are a couple of assisted livings in Rockland County that, again, will be about $2,000 cheaper than Westchester County.
Wow.
Yeah, and then you know, another option too is if you're very adamant with Medicaid and you want to have mom or dad in assisted living, another good option to consider is also New Jersey. And the reason why New Jersey is because all the new buildings that were built, I believe, after 2015 are required to have 10% of their apartments to be Medicaid beds. So, and also same thing with Jersey. Jersey usually is somewhat cheaper than Westchester County. You know, nothing crazy, maybe 1,000, 2,000 cheaper. But if your long-term goal is to eventually have mom or dad in a Medicaid bed, but you want them in assisted living, New Jersey can also be another viable option as well.
Hmm.
A lot of communities, assisted living communities in Bergen County, so not too far from Westchester.
I thought I saw somebody said, thank you for your presentation. It was very helpful. Loved your breakdown. And somebody else asked, can you please repeat the name of the new building slowly? Not sure.
Sure.
Yeah.
I did
Yeah,
that.
so so we're based in Briarcliff Manor, New York, in northern Westchester. We're also building another one more north to us in Somers. That's going to open up in late 2021. We are in the process of building one in Tarrytown. We're building one in New Rochelle. We're working on building one in Manhattan. We are building one in Comac, Long Island, as of right now, which will also open in late 2021. We're also working on building one in Oyster Bay, Long Island. And our sister community in Chestnut Ridge is also already built and fully staffed. It's just waiting. It's in the same situation as us. We're just waiting to open as well. Those are the ones right now in New York State. Up and they're in the planning stages.
So I missed the first part. I think I missed something. So all those places that you mentioned in Westchester County they're not the same type of facility though.
They are, yeah. Artis only has 2 communities that have some assisted living attached to it, but our basic model is strictly memory care. So
That's a lot of buildings in a very small, in Westchester County, just mentioned a lot of different towns.
Yeah, well, it's based on the demographics. So someone living in Tarrytown normally is not going to want to schlep it all the way to Somers to see their mom and dad. And
Or New Rochelle.
Or New Rochelle.
Right.
Yeah, exactly. And it's a different demographic. People are not willing to. Everyone has a car. Someone normally would rather travel 10 minutes to see their mom than travel 40.
Yeah.
Also, Colin, there's really not many options up in that Putnam area where all they have to do is come straight down Route 6 from Brewster, Carmel. There's very little up in Putnam County, even up in Dutchess.
And the other thing too is that a lot of these memory care, a lot of these assisted livings that already have memory cares attached to it, they've been around for many years, and most of them are pretty much full. If they have availability, you're talking maybe 1 or 2 beds at the most. So there's a lot more need than there is supply when it comes to memory care at the moment. So,
yeah, well, I really like the concept that you guys are specifically geared just towards that, because I did a virtual tour with them, and the idea that people can pretty much go in it wherever they want, which is great for somebody with dementia, who you want to allow them to wander about and move. You don't want to restrict their movement to only inside and only this little space. That they have that freedom there is really, I think, pretty forward thinking, because that's not how a lot, I've been to a bunch of memory care units and they're one little floor and that's it.
Yeah, very confined. Yeah.
It's very confined. Yeah.
Very confined.
And that can cause some behaviors and agitation, especially if the person was in the bigger part of the assisted living and they know that there's another part to this building, and then they're relegated to a hallway with a locked door, and it does cause problems.
Yeah.
Yeah.
I know
It's
that.
important to be able to go outside too, even
Right.
just to
Yeah,
know that
and there's
they-
also,
you know.
and also I was gonna say too is that because from my experience, I've worked in buildings where we had assisted living and memory care, and unfortunately, when you have that type of setup, there is a stigma. People that live in assisted living do realize when someone that lives in memory care is coming up to have meals with them.
Yeah.
It's different because of COVID. A lot of things are restricted, but it's a stigma that a lot of families realize and they feel it. And even though that person has dementia or Alzheimer's, they feel it too. When people are staring at them and wondering why is that person coming up for meals, and vice versa. It's rare that if the activities director tried to do a program in memory care with the assisted living residents, it was far and few that were willing to go down there. It's just it's two different setups. It's two different types of mindsets of where they're at. And in my opinion, I think they should just be totally separate. I mean,
It's really an interesting concept. I'm really excited to see how it works when we get our first residents. We both had to go to different communities where we got to see the Artis way in action, and their whole philosophy is we try not to say no, we try to say why not.
yeah,
What's it gonna hurt?
Yep. So-
Make somebody stay,
yeah, exactly. I mean,
Couple
yeah.
more questions, just so you know. One of the questions was, is it a nonprofit organization, and who owns the company?
So we are
yeah.
Go ahead, Laura. Go ahead.
Go ahead.
Oh, yeah. So we are a for-profit organization. We are not a nonprofit. We're a privately owned company. So
We are owned by the Bainham family. The Bainham
Yeah.
family owns Choice Hotels, and they also owned a home care agency for over 50 years.
yeah.
They're based out of King of Prussia.
Okay.
And then what was the other question?
Other question was, what is your largest challenge at this time, or biggest challenges at this time?
Getting an operating license.
Yeah, exactly. Opening.
That's our largest challenge.
I know.
We've got
Yeah.
plenty of people ready to move in. We've got lots of people that have needs, especially since in the county, the adult day programs are not running because of COVID. You've got people that are in a sandwich generation that are doing homeschooling. They're working from home, and they've got their demented parent with them who keeps being brought back by the police. They can't keep them engaged. It's really complex when they're not able to go out to any kind of a program. So, we really feel bad that we can't help these families that are struggling right now.
Yeah, absolutely. All right, one last question was, will Laura, and I guess it would be Laura or Jonathan, give the tours, and how does one contact them?
You can call us directly at 914-800-9057, and you can email us. We have both of us have emails.
You want to put
And
Put them in
yeah,
the
we'll
chat.
put those up in the chat,
put them
and
in
we're
the chat.
happy to, we're happy to take you through. And we've been doing tours almost every day, a lot of professionals and families. And I was on an assisted living meeting today, and it's really interesting how all of the assisted livings in Westchester County are getting an uptick in business. All of us have been getting a lot more inquiries. And I think that this, people have been able to manage so far, and now with winter coming and everybody going inside, it's going to be a little bit more complicated of not being able to walk mom or dad outside, or whatever it might be. So I think that people are finally saying, okay, I've done this for 7 or 8 months now, and if this is going to go on for another 8 months, there's no way.
I think you're right.
Yeah.
I also think that, losing the adult daycare is a big thing.
Yeah, absolutely. I mean, because that's something that, there's a huge gap of time that if someone was able to drop their loved one over from, 9 to 4 or 9 to 3,
Right.
and all of a sudden that's taken away from them, and they have their loved one living at the home and they're working from home, it can become very challenging very quickly.
Yeah, especially the working from home thing. I'm hearing a lot from families
Yeah.
with regard to that. A lot
Very
of
difficult.
frustrations trying to work and answer the phone and be in a meeting when
Right.
can't do that.
Yeah, it's very
And
difficult.
you got 3 kids that are all on computers, homeschooling and
Mhm.
whatever. But somebody just asked a question if we could do this presentation in Spanish. I'm sure we could make arrangements to have that done, as we've got plenty of Spanish speaking folks in our community.
That's a great idea.
Yeah,
Yeah.
it won't be me, but it'll be someone else.
No, our director of health and wellness is Spanish.
Yeah, she
so,
speaks Spanish. Yeah.
Yeah.
Absolutely.
Okay, so if there are no other questions, I'd like to wrap this up. I'd like to thank you guys for presenting. Looks like we had about 13 people that attended. There was more on earlier. Looks like we had a total of 15 to begin with. So it was a good turnout, and we do put this video together into something that we post on our website. So people will be learning about everything that you taught us here today in another format, which will be very nice. So
Great.
So I'm going to assume that I haven't heard and seen any other questions at this point, that we've gotten all the answers, all the questions answered. And I want to thank everybody for coming and supporting the Boxwood. And thank you.
Thank
All right,
you,
thank you for
everybody.
Thank you, everyone.
Have a wonderful evening and have a happy Halloween.
Thanks.
Yes, take care. Have a good evening. Have a good weekend.
All right. Bye-bye, everybody.
Bye.